started on the ruminant respiratory system, and we looked at the history and physical exam of the respiratory system in ruminants. We pointed out a couple things in notes, when they had capital letter notes, and had underlined, and those were pretty important. And then we looked at the diagnostic tests that you could apply to work up the respiratory system, work up, investigate. There are a couple other synonyms when I say work up. So that brings us to our diagnostic approach to alteration. So what I stress a lot, you guys might have noticed, is normal and abnormal. And when you're trying to become a clinician, which is what you guys are trying to do for the most part, then you want to have a rational approach to what will you do when you encounter an abnormality, a deviation from normal, an abnormality in a particular body system. So we're looking at the ruminant respiratory system. So, and the whole purpose of these notes is to give you an idea of how you'd approach it, and also to try to get you to think more clinically. So let's see. All right. So when you're presented with an animal that's coughing, so there are a couple of things that you want to bear in mind. From the history, you're going to get that it's either an acute onset of cough, or that it's a more chronic cough that's been going on for a while, more chronic sort of cough. Okay, and the purpose of this is not to have you memorize, but to have you think about why you would get an acute cough, why would you get a chronic cough. So an acute cough is something like an acute infection. That's fairly intuitive. An allergic reaction, you start coughing. A foreign body, you definitely start coughing pretty acutely, or a choke, or some sort of trauma. So as you're presented with these animals that have these clinical presentations, that's how your mind starts thinking, what could be causing this onset to be acute or chronic? Certainly a chronic infection that's been going on for a while, it can produce a chronic cough. And lungworms, especially small ruminants, you can see the presentation through coughing. In larger ruminants, the presentation is not often coughing, or in horses, it's not often coughing that's the presentation. But in small ruminants, one of the causes of a chronic cough may in fact be lungworms. All right. Some other things you want to do as you're working up these different body systems is you're trying to localize where the problem is. So in the course of your physical examination, an upper airway cough, so that's the nasal passages, larynx, pharynx, trachea, sinuses, everything before you get to the lungs. So if the lesion or the cause of the cough is in the upper airways, you tend to get this presentation. So it's more of an acute onset, pretty loud cough, and tends to be relatively dry and non-productive. So as you look at the animal, you're noticing it's coughing and then it doesn't swallow, versus the productive cough, when you cough and then you swallow. A productive cough tends to be originating, or the lesion or the source of the problem, the source of the disease, source of the infection, tends to be the lower airways, and when they cough, they tend to produce some mucus, some secretions, and then they swallow. And tends to be chronic onset, tends to be a relatively soft cough versus the upper airway cough originating in the upper airways. All right. So these are just clues, just hints. There's lots of ways we could ask you about this, acute versus chronic, upper airway versus lower airway. So as you read through it, you don't necessarily memorize, but you think about what would be causing this acute cough, what would be causing this chronic cough, and also why an upper airway cough would have an acute onset, because it's usually having to do with an allergic reaction or maybe a choke or trauma, for example. So it's going to be an acute onset. It's going to be pretty loud. The animal's trying to clear the obstruction, and it tends to be non-productive, relatively dry, versus the lower airway cough. So as you read through your notes, as you read through your slides, think about how you can compare, contrast these different presentations. As far as the diagnostic tests, CBC, fibrinogen will help you with an infectious disease. You'll see your white blood cell elevation, your fibrinogen elevation, etc. We'll do more about that next semester when we go into infectious diseases. You'll notice when you go back in the clinic, depending on who you work with, what clinician you work with, I like to order fibrinogen when I do CBC. With large animals, the fibrinogen tends to elevate before the white blood cell count, so it's an earlier indication of inflammation than your CBC. So sometimes you'll get an elevation of fibrinogen before you get an elevation in your white blood cell count. So you'll see me ordering CBC plus fibrinogen pretty routinely. Some other diagnostic tools to work up the cause of a cough would be endoscopy, depending on whether you could afford it or whether the client can afford it, transtracheal aspirate, and radiographs. All right. So another abnormality of the respiratory system is when an animal presents with a nasal discharge. And what you want to do with nasal discharges is you want to describe them, you want to characterize them, and you want to say whether they're serious, whether the discharge is serious, mucoid, purulent, hemorrhagic, and whether there's a foul odor associated with it. Last week I told you that anaerobic infections tend to present with a foul odor, and so that's just one clue that you could be dealing with an anaerobic infection. And this is pretty much the progression of an inflammatory exudate from serous to mucoid to purulent to hemorrhagic. So you guys are familiar with this from your pathology class, for example. Another thing you want to characterize a nasal discharge as is whether it's profuse versus scanty, whether it's continuous or intermittent, whether it's unilateral or bilateral. This just helps you to localize again where the source of the problem may be. And some generalizations, and again, you know this from pathology. Early on in the course of an infection, as the body is reacting to the infection, basically trying to wash it out or trying to dilute it, so you get a more serous or mucoid discharge. So that's typical of an early infection. Most of you have had colds, for example, so you notice that you have a serous or watery nasal discharge early on in the course of your cold, and then later on you get a nice, nasty, thick, yellowish stuff, blowing that up into your handkerchief or your tissue later on in the course of the infection. Yes, ma'am?
What was the difference between profuse and scanty and continuous or intermittent?
Oh, so these are just terms having to do with the volume of the discharge, profuse versus scanty. And what this can tell you is it can tell you, for example, whether it's early on in the course of the infection, you're just going to start having that watery or serous nasal discharge, and then later on in the course of the infection, you get a more profuse nasal discharge. So as you're looking at the animal, you say, okay, profuse nasal discharge, so this has probably been going on for a while. All right? And, continuous versus intermittent, same sort of thing. Are you getting a continuous discharge, so the infection's probably taking hold, whereas intermittent, it might just be starting. And unilateral versus bilateral, what that can help you with is how far back in the nasal passages the source of the infection is. Before you get to your septum, so is it further back in the sinuses, or is it more rostral, as to whether the discharge is going to be from both nostrils or just one nostril. So basically, you're just trying to gather clues. Okay? And then your diagnosis, like I said, you know, early versus late, and some of these will help you. Now, a word of caution about nasal swabs is that you tend to get a mixed population of bacteria when you do a nasal swab, so it's difficult for you to determine what the cause of the infection was with just a nasal swab. The time that we'll do nasal swabs is, for example, when you have a viral infection, like something like an infectious bovine rhinotracheitis, because, you know, in addition to the mixed population of bacteria, you'd also get the virus. So that would help you to determine that you're dealing with that virus. Otherwise, you probably wouldn't routinely use a nasal swab, especially later on in the course of the infection, when you have a big, you know, purulent nasal discharge. Everything's probably diluted out anyway, so you probably wouldn't get a good culture if you submitted that nasal swab. Early on in the course of the infection, we have a serous or mucoid discharge. You would probably get a higher density of viral particles in that discharge, and you might get a better result. Sinus centesis, you know, depending on whether you think the nasal discharge is just sinusitis, you percuss the animal, you hear a dull resonance on one side versus the other, or you've done a radiograph and you see the increased opacity. If you wanted to further diagnose it, you could do a sinus centesis. And endoscopy and radiographs, again, just try to localize the source of the nasal discharge. All right. I got to wash my eyes out. You guys do not leave